that currently they're going through a major crisis. We have only to think of what's happening with overtime, mandatory overtime among nurses, which is a total disaster. Every day, every single day, nurses are being forced to stay at work, even though they're exhausted. They no longer feel able to do their jobs. They can't even think anymore. They're forced to stay at work for 16 hours at a time. And then we wonder why people don't think of seizing an opportunity or have the clinical reflex to go through the organ donation process when we have women who are completely exhausted by a healthcare system that is sick. And the government seems to act like it's not seeing any of this and is limiting healthcare transfers and is saying that the province is the one that's responsible for what's going on in hospitals. We have nothing to do with that. If we force women to stay at work, to be unable to go and get their children, who leave work crying, who change careers because they're completely exhausted, well, I think that we have a whole other problem on our hands, and I would sincerely wish for us to take into account what's happening in our hospitals right now to try and solve public health problems that are very important for many people. I think we would not look at healthcare situations with the blinders that some people seem to have on. I would ask people to take their responsibilities seriously and to look at the crisis that's currently going on